As early as the 18th century, animals have been found to provide health benefits to patients with mental disabilities. Sigmund Freud often had his dog Joffe present during psychotherapy sessions and found that the patients, especially children, would talk more openly when the dog was present. Animal-assisted therapy, also known as AAT, is simply the use of a trained therapy animal incorporated into the clinical treatment process. Research has shown that having dogs present during therapy sessions can reduce feelings of stress. Animal-assisted therapy may help lower the patient's stress and anxiety levels without the negative side effects of medication. In a study conducted by Sy, Friedman, and Thomas in 2010, 15 children participated in the study, and each of these participants was hospitalized for a minimum of 2 days to sustain an outpatient procedure. As you can see in this graph, systolic blood pressure was measured prior, during, and post visitation. They had patients who went with who had animal-assisted therapy sessions and those who just had a puzzle intervention session. The participants' systolic blood pressure continued to decrease as well with the patients who had animal-assisted therapy, indicating that the benefits of therapy dogs take effect even after the visitation. This proves that a child's stress responses can be positively influenced by the presence of a therapy dog. A study conducted by Barker and Dawson in 1998 focuses on anxiety levels of hospitalized psychiatric patients. The reduction in anxiety scores for patients with psychotic disorders was twice as great after animal-assisted therapy than that of the scores after therapeutic recreation sessions. During AAT, a child can be encouraged to talk to and pet therapy animals to help reduce the child's anxiety levels. Heightened anxiety levels can hinder a patient's treatment plan, and AAT can be used to help reduce the patient's anxiety levels. Animal-assisted therapy has been proven to improve a patient's mental and emotional well-being. Participants of a study conducted by Klontz, Bivens, Leinhart, and Klontz in 2006 were tested through a personal orientation inventory test consisting of 150 questions to determine their psychological well-being. As you can see in this graph, there is a significant increase from pre-test to post-test of the patient's psychological sense of well-being. There is a slight decrease in the 6-month follow-up, but it's only 2 points. It's not significant at all, and this just indicates that not only does AAT increase a patient's psychological well-being, but it also has a long-term effect. According to Silva et al. In 2011, therapy animals have been known to contribute to the release of endorphins as well as the relaxation response in AAT participants. This leads to a feeling of well-being that improves the outcome of therapeutic interventions. Having a greater sense of well-being can greatly determine the patient's treatment outcome. The significant reduction of stress and anxiety, as well as the improvement of a patient's well-being that AAT provides, is definitely worth the continued study of AAT benefits. Complementary therapies are used often in conjunction with medical treatment plans, massage therapy, acupuncture, aromatherapy, chiropractic therapy. They are all complementary therapies, to name just a few. Does AAT deserve to be high up on that list as well? Discovering the many benefits of animal-assisted therapy in time will only tell. Thank you. Any questions?
Are there any other animals used in animal-assisted therapy?
That is a great question. There are lots of different animals used in animal therapy. Dogs are the most common animal used, but horses, cats, birds, dolphins, rabbits, I said horses twice, I apologize. Rabbits, llamas, and even guinea pigs are known to contribute to the health of humans. Any other questions?
Well, I was just curious of what kind of facilities can a therapy animal visit?
Another great question. Because therapy animals are so well trained and healthy, they can visit just about all facilities ranging from acute care hospital, nursing homes, schools, and daycares. Thank you.